In this video, we are going to be talking about the regrets what our patients may have following a breast reduction surgery. Now, the first regret which patients may have is scarring. Now, if you do not discuss this issue with your surgeon, you're likely to be disappointed because you're not being told about what you may end up having. Now, typically after a breast reduction surgery, you may have a lollipop kind of incision, which is around the areola and goes below the areola to the breast up to the fold. Now, this is usually given in a moderate sized breast where you're reducing around 500 to 700 grams of tissue, and that's the scarring which may result after a breast reduction surgery. So you may want to know that this kind of scar may appear. Now, the second most common scar which one may have is the lollipop scar, but a little more longer. We call it the J's kind of a scar, which is usually seen in our patients. Again, it's a good scar to have because the areolar scar is potentially not seen, and what is exactly seen is the J extension, which is going into the inframammary fold, which you may not see, and what is actually seen is only 2 centimeters of the portion when we're actually standing in front of the mirror. The inverted scar is, in our practice, we don't use it, so we don't give the scar, but if there is too much of excess of skin in the breast, we may end up giving an inverted T, which is again very rare in our practice, but you should know that this scar can also result. The second regret our patients can have after a breast reduction surgery is the size. Now, this is a very tricky question because there's no device, there's no apparatus, there's nothing to measure how you can actually reduce the volume of the breast. But with our experience, using the software, using clinical experience, you can actually tell the patient that this is the kind of reduction you may have. You may have 300 grams of reduction, you may have 500 grams of reduction, or even more. Now, we use what is called as a syringe technique, where we apply the syringe on the breast and we can kind of visualize what is the kind of reduction they're going to have. Now, typically I tell my patients that if they have 300 grams of tissue taken from the breast, the cup size is going to come down by 1 cup. Now, if they have 600, they're going to reduce by 2 cups. If they have 900 grams of tissue removed, the cup size is going to drop by 3 cups. So this is what we normally tell them. And of course, we also have the software, the Chrysalis software, which we make our patients, we photograph the patients and we actually interact with our patients as to what the breast is going to look like. And the software gives us all the details of how much volume to remove or how much volume can be removed from that portion. And based on a rough estimate, we come to a conclusion and we say that this is the kind of breast size and shape you're going to have. Now, we don't tell our patients that exactly you're going to be this much, but it's an approximation because some patients may want to look big enough, so we discuss with them what their goals are. So we know that they want to look big, so removing less of tissue will keep them happy. But there are some patients who want to be extremely light, who want most of the breasts, heavy breasts to be removed. So in these cases, we go on the side of removing more breast tissue. So ultimately, it's the patient's requirement and our understanding, and once we come to an agreement, that much amount of breast volume is going to be removed. A lot of our patients are worried about regrowth of the breast back after reductionoplasty. Now, regrowth is something which is very rarely seen after a breast reduction surgery because the surgery physically removes all the breast tissue, including the fat. So there's not going to be any kind of a recurrence. But if a patient maintains unhealthy lifestyle, the eating is going to be erratic and there are more calories which are going in, obviously this patient is going to put on some fat, and this fat is actually going to show up on the breast. But this doesn't really happen so commonly, but patients should be aware that faulty lifestyle habits can actually cause some fat deposits and making the breast to look bigger. But as such, regrowth after a breast reduction surgery, until unless there's a hormonal problem, may not happen after a breast reduction. The symptoms of back pain sometimes may persist after a breast reduction, and this usually happens when a patient is getting a small or a moderate reduction where the size of the reduction is almost 500 grams and less. So it's unlikely that patients who experience backache may get relieved, because the backache could be caused by all other reasons, which is in the domain of the orthopedic surgeon. So severe reductions, definitely the patients will have a benefit from breast reduction surgery because of the weight, the physical weight which is being removed, where the amount of weight which is removed is more than 1000 grams. So definitely in such cases there is bound to be improvement in the symptoms, but in mild to moderate reductions they may not be, because the causes of back pain are many and your orthopedic surgeon will probably tell you what the other causes could be. A lot of our patients ask about sensations following breast reduction surgery. Yes, this is very important for their functions, for their day-to-day activities, and especially when they are meeting their spouses during sexual activities. Now, when we do a breast reduction surgery, we preserve all the nerves. Now, we have a technique where we do not touch the nerves, and when we do this, usually the sensations grow back into the breast tissue, into the skin after 3 to 6 months. Some people it may take up to 6 months, some people it comes back as early as 3 months. So sensations is usually not much of a problem after a breast reduction surgery.